Hi, class. It's Dr. Lindner. Let's take a look into the oral cavity. And this is the beginning of the digestive tract. The oral cavity contains a variety of different parts that really do play an important role in digestion. We will talk about the lips, we'll talk about the teeth, the palate, the uvula, the tongue, and the salivary glands. So when we look at the oral cavity, it's made up of a few important parts. Here we can see the superior lip. Here we have the gums known as the gingiva. Here is the palatopharyngeal arch. Here is the palatine tonsils. Here's our tongue. Here's the frenulum that's often cut on certain individuals if the tongue movement is somewhat restricted. Here's the gingiva, the gums on the bottom. Here's the inferior lip. Here is the hard palate towards the anterior part. Soft palate as we move a little bit posterior. Here's the uvula, right? When someone says ah, this should move up, as well as this and this. These should move up symmetrically. Oftentimes we'll get the uvula that deviates, and we'll see that the soft palate does not rise symmetrically. This can be indicative of cranial nerve damage, usually 9 and 10 post-stroke. Here's the cheek. Back here we have molars, and we have our premolars. We have the canine, known as the cuspid. Then we have incisors. We have central incisors and then lateral incisors as well. Okay. Here's the cross section just showing the oral cavity, and I wanted you to see how large this muscle is. This is all tongue, if you look at that. Okay, that's all tongue. Back here is the uvula, and then here is the epiglottis. So the lips, these are two large fleshy folds. It lines the opening of the oral cavity. It's composed of skeletal muscle. The skeletal muscle is referred to as the orbicularis oris. The external surface and internal surface are a little bit different. The external surface is covered by tough, hard, dry, pigmented skin, and the internal surface is covered by mucous membranes. Now, mucous membrane is the tissue that is composed primarily of epithelial tissue, some connective tissue, and the type of membrane secretes a mixture of mucus, which the mouth needs, and serous fluids. The mucous membranes occur any place in the body where the external environment of the body comes into contact with the internal environment. So we need mucus and serous fluids anytime the outer world is coming into contact with the inner world. The lips are designed to seal the oral cavity. They also help manipulate food into the oral cavity, right? I think of horses, they do that when they grab hay, right? They use their lips to manipulate and bring food in. Think of spaghetti. If someone eats spaghetti, they keep doing that with their lips to pull that in. There's protective function of the oral cavity because of all the high sensory nerve endings, right? When I say protection, you can touch something to the lips and go, it's too hot, right? Some people touch it and they know, okay, I'm going to wait for this to cool off so I don't do damage to the roof of my mouth, to the esophagus. The lips are also involved with speech. In terms of certain diseases of the lips, what comes to mind is the herpes simplex infection. There are several viruses in the herpes family. There's varicella, There's the Epstein-Barr virus. There's the cytomegalovirus. There's herpes simplex 1 and herpes simplex 2. Chickenpox can often result later in life in herpes zoster, aka shingles. Shingles tends to follow nerves. They tend to follow the path of intercostal nerves, which is the nerves between the ribs, but it can also follow the cranial nerve, especially cranial nerve 5, the trigeminal nerve, so it can affect the face. It can go to the ophthalmic branch, the maxillary branch, or the ophthalmic branch, the maxillary branch, and mandibular branch. The maxillary and mandibular branch, when they get affected, it will target the lips. Herpes simplex 1 is known as oral herpes, and herpes simplex 2 is known as genital herpes. Both type 1 and type 2 can actually cause herpes around the lips, though. Okay. The herpes virus, keep in mind, viruses are opportunistic and they're looking for the opportunity or for the weakened environment, right? They're looking for a weak host, a susceptible host. And once it enters the body, it will be there permanently. And they tend to only come out and express themselves again when the opportunity arises, which is a suppressed or weakened immune system. The symptoms of herpes, in many patients, they'll experience some initial pain in the beginning, a little bit of tingling over the area where the blister is about to occur. It typically shows up in the lower lip. It starts to ulcer, it blisters, and then it crusts, and then it heals. And it could take around 10 to 14 days for this to happen. And the causes are both herpes simplex 1 and 2 virus. What I've used in the past for many patients is incorporating both vitamin C as well as lysine. Lysine is an amino acid, and it's known to block the absorption and utilization of another amino acid known as arginine. And arginine is required for the production of the herpes virus. It's required for herpes to thrive. So it acts, lysine is like a decoy, if you would. It's been very, very helpful and beneficial. This is what oral herpes looks like. You can see it's already crusting over here. These are the blisters that start to form. In terms of lip cancer, this is an accelerated growth of abnormal epithelial tissue that line the lips. The symptoms are typically a painless ulcer or a pigmented type of patch. Smoking is always the cause, and UV sunlight, UV rays. The therapy is typically surgery, radiation, and chemo. The concept to chemotherapy is literally poisons that are designed to attack and kill rapidly multiplying cells. The cancer cells are rapidly multiplying cells, and the radiation and the chemo are used to kill and destroy those cancer cells. These therapies attack the fast-growing tissues of the tumor, but they also attacked the healthy tissue and the individual. And the whole philosophy of chemo in traditional healthcare is that there's more of you, more of the healthy person than the tumor. So healthcare professionals really do hope that the chemo and the radiation destroys the tumor, preventing the spread of that, the metastasis, the spreading of it before the medication compromises the individual's life. That's the theory to it. This is what lip cancer looks like. You can tell this is a smoker. You can see the tar build up. You can see the tar accumulation in the teeth, the broken teeth, poor hygiene here as well. Okay, when we come back, we'll talk a little bit about the teeth.